life. 10 fingers, toes, a set of eyes and ears, 1 mouth, and a healthy set of lungs. Welcome to the world, little Kelsey. Hello, I'm Carolyn Marshall. If you've ever watched a newborn, and they are wonderful to watch, you get the feeling that this whole new world around them is theirs for the taking. Look at her parents, anticipating the future, and her grandparents, remembering the past, when they too stood at a window like this and looked at their own newborn child. Soon, Kelsey will be going home to become part of a family of sisters, brothers, aunts, uncles, cousins, and grandparents, a network of people who will be involved in raising and caring for her. Kelsey's parents have used this informal network before with their other children. It includes not only family, but also neighbors in churches or synagogues. Right now, baby Kelsey has a life expectancy of 75 years, and with new advances in medicine, she may live longer. But this program is not about Kelsey. It's about her grandparents and people like them above the age of 60. It's about the quality of life that our parents, ourselves, our children, and generations to come could all face. Many people are reaching old age at a time when the cost of living is high. Healthcare costs are soaring, and their economic resources are limited to Social Security and Medicare. The rich have their own financial safety net. The poor have assistance from the government. And the middle-class elderly? Well, they're the ones caught in the middle of a candle, burning at both ends. Too much income for services supplemented by the government, and not enough to afford them on their own. And soon this middle ground will be expanding. Cutbacks loom on the horizon. Federal and state governments are requiring ever lower incomes to be eligible for supplemental aid. And these people who really need it will have the last years of their lives boiled down to, "I'm sorry, you're just not eligible," or,
"We just don't have a program for you anymore."
Often when this happens, individuals within the informal network band together and try to help those who fall through the cracks. Isn't it a beautiful day? The sky is clear. There's a breeze in the air. We all know that exercise is good for young and old alike. So come join me and my friends on our bikes. More exercise and better eating habits are keys to better living. But there comes a time when some of us may be unable to eat properly, to live by ourselves, or even to take care of our basic needs. When this happens, we need help from the informal network. But oftentimes, this network can't meet all of our needs. So we turn to the formal network, made up of private and government agencies, many funded by the United Way. As the spokes on this bicycle wheel support the rim and us on our trip through the park, the programs provided by the formal network support us as we go from being independent to increasingly dependent. At the center of the wheel is the elderly person, and in most cases his family. 80% of all care for the elderly is provided by the family. If the need arises, the individual or the family can take advantage of programs available through the formal network. They include family counseling services, support programs like As Parents Grow Older, neighborhood centers which sponsor health clinics, recreation activities, and socialization programs. Many centers even offer nutrition sites where a balanced meal is provided at minimal cost. It is a sad fact that many elderly persons are placed in nursing homes because their families are afraid they might fall and hurt themselves. But most older people prefer to live in their own homes, and they cling desperately to their independence. One way to feel independent, but to have a measure of safety, is the emergency response system. If an elderly person should fall or become ill, emergency help can be contacted immediately. There are also protective service programs to investigate abuse, neglect, or exploitation. As the elderly person becomes more dependent, needs more care, but wants to remain at home or the home of a relative, there are homemaker and home health services, which take care of an individual's medical and personal needs. There is also the more familiar Meals on Wheels. If a person does require full-time supervision or wants to socialize to keep from feeling isolated, then there is daycare for adults. Thank you. There's a variety of options for the older person who doesn't wish to live in his family's home. Congregate living, apartments, high-rise complexes for the senior citizen all offer a measure of independence as well as some security. Another option is foster homes for senior adults. When an elderly person is living in the home, it can be very stressful on family members. Here comes one now.
Hi, honey. I'm home. What have you been doing all day? This place is a mess, and I'm hungry.
I've been taking care of your mother.
Sometimes the caregiver gets sick or has an emergency. That's when there is emergency respite care.
Hi, I'm Mary Snow with the Respite Agency.
Hi, Mary. Come on in, please.
Thank you.
This gives the primary caregiver a chance to take a break or time off to handle any personal business or an emergency.
This is Mary Snell. She's from the Respite Agency.
Hi.
Hello,
Nice
Mary.
to meet you.
Nice meeting you.
As we come full circle, there are the more traditional options, a hospital or a nursing home with different levels of care. A less traditional option for some is hospice. As you can see, there are many programs available, but there is neither the money nor the people to expand these programs. And as the programs dwindle, there will be less and less available to support the family. If workers have to spend time and energy worrying about their mother or father, or an aunt or uncle, it hurts productivity. You've seen it before when a child gets sick. Until recently, it's been the female worker who was hit hardest. But with the male sharing in the raising of a family, both males and females can be expected to share in the care of an elderly relative. Realistically, women live longer. If she and her husband have retired from the workforce and he becomes ill, she will be the one caring for him, with only a part of his medical bills being paid by Medicare. When he dies, the income from Social Security will be cut in half. If she becomes ill, then chances are good that her daughter or daughter-in-law, who herself could be in her 60s, will be taking care of her. Earlier, I mentioned that when funds are cut, people band together to try and fill in the cracks. The Alamo Area Council of Governments, Area Agency on Aging, has started the Bexar County Senior Citizens Trust. The funds collected will be used to complement and supplement existing programs, to enhance the availability and accessibility of needed services, and to create new programs. Now, what could these new services be? First of all, people need to know that help is available, that there is a whole range of services out there. Then they need help in picking the programs. I guess the best terms to use would be comprehensive assessment and case management. Some organizations evaluate clients, but only for programs they offer. This program would evaluate the person and his family's need, not only plugging them into the right program, but also continually following them. This evaluation and follow-up crosses the boundaries of staff and budget limitations set within the formal network. But what other programs might be started? Filling prescriptions might be one of them. The Texas Medicaid program provides free medicines to persons who qualify, but prescriptions are limited to only 3 per month. Home repair would be another program. Religious and civic organizations sometimes send out repair crews to houses of the poor and elderly which are in desperate need of repair, but there are so many houses and not enough weekends. Without door-to-door transportation, the elderly cannot participate in existing programs. Many have tried metropolitan transit, but have found it woefully inadequate.
Hi, Daddy.
Hi, honey. What are you doing?
I'm making out a check to the respite agency. They're going to be...
Emergency respite care has to be expanded. If you are the only one taking care of your father and an emergency comes up, or you need a break, getting someone to take your place can be an expensive proposition. And finding the right person can be harder.
Oh, no.
Now, there are many more programs that could be started with the trust fund. These have been just a few. Think of it as a small investment for a big return. Like dominoes set one next to another all in a row. Something happens at home. Your employees are absent. But the loss is not just measured in productivity. It is also measured in emotional, physical, and financial stress, not only at the individual level, but at the corporate level. With your help, the Bexar County Senior Citizens Trust can keep that first domino from falling, strengthening the family and the community at large. Now here is someone to talk about the financial aspects of the trust.
Hello, I'm Darby Riley. The Bexar County Senior Citizens Trust is a charity organized in 1986 under the umbrella of the San Antonio Area Foundation, a community foundation started in 1964. The Bexar County Senior Citizens Trust is a tax-exempt, nonprofit fund, and all contributions to it are deductible under the Internal Revenue Code. The terms of the trust state that all monies collected are to be used to support local activities for the aging. Primarily responsible for determining the best use of money contributed to the fund is the Senior Advisory Committee of the Bexar County Area Agency on Aging, which is a part of the Alamo Area Council of Governments. 33 people who represent every major government, private, and volunteer agency involved in issues affecting the elderly in the Bexar County area are elected to the Senior Advisory Board. This board regularly makes decisions on the allocation of government money to senior services and is best equipped to determine the proper uses for the trust fund. NBC Bank San Antonio is the trustee bank for the Bexar County Senior Citizens Trust. If you would like to donate to help the senior citizens of Bexar County, please contact the ACOG Area Agency on Aging or the speaker who is presenting this program.